Right, with America seeing a record number of cases of this latest variant of COVID, the hospital worker shortage in many parts of the country is becoming more severe. And the growing concern over the shortages is leading some hospitals to tell their employees that they can work even if they have tested positive for COVID amid a staffing crisis. Well, given the latest COVID surge and the fact that the Omicron variant can spread to both the vaccinated and unvaccinated, how might the Biden administration defend its case for forcing federally funded healthcare facilities to fire unvaccinated workers when the Supreme Court hears the oral arguments on this mandate coming up this Friday? With me now to talk about this is one of the several state attorneys general who are defending healthcare workers in the court, Indiana Attorney General Todd Rokita. General, welcome back to the program.
Yeah, thanks for having me, Tony. Happy New Year.
Thank you. Happy New Year to you as well, and I hope it's off with a bang when you go to the court on Friday. I hope and pray you're successful. In the filings of the Biden administration, they're now saying, well, this isn't a mandate. We're not mandating this. Is that going to hold up before the court?
I don't see how it can. We'll be prepared for court on Friday. You know, myself and our staff, my staff, and other like-minded attorneys general and their staffs. And no, we don't see how this is anything but a mandate. When you say to a healthcare provider, employer, like, we're going to hold your Medicare and Medicaid funding unless your employees are vaccinated, that's like sticking a gun to a hospital or any healthcare provider's head. Because, and this is a whole separate segment of your show sometime, Tony, I mean, they're so beholden to federal dollars. And so the Biden administration knows this, and they're using this latest variant and some of the numbers, whether they're true or not, to tell the court, hey, we need a decision sooner rather than later. And to that I say, so be it. So we get a decision sooner rather than later. We're prepared to uphold the individual rights of healthcare workers to decide for themselves with their doctors what's best for them while they responsibly take care of patients.
Yeah, there's two cases before the court. You're focused on the one dealing with the healthcare workers. I would think that would be it would be a slam dunk in my view, because one of the arguments that the Biden administration is using to force these mandates is they want to keep Americans healthy, safe. They want to keep them from dying. Well, how do you do that when you're forcing healthcare workers out of business? You're firing them because they won't submit to your vaccine mandate. I mean, that's actually making our healthcare system, putting it into a crisis.
Absolutely, especially during this time. We need all hands on deck. You know, a year ago, we were heralding our healthcare workers as heroes, and they still need to be upheld in that vein. And how do you tell a hero that you're not responsible enough or you don't know enough to make your own healthcare decisions? You know, it's ridiculous. The fact of the matter is that, every decision to vaccinate or not shouldn't be governments at all. It should be between you, your doctor, and God himself. That should be where your decision points, the decision point lies, not in the federal government.
General, just so people have a kind of a reference point, they talk about Medicare, Medicaid facilities. They, I'm not on Medicare. I don't get Medicaid. It's not going to affect me. But that's not true. This is far-reaching in the implications this has for doctors' offices, hospitals, that will be impacted by this.
Yeah, and that goes right back to, Tony, what I was saying earlier, where, maybe it's a whole separate discussion. Sometimes it should be. These healthcare providers, these hospitals, these doctors' offices, these clinics, everyone really in the system, even though I maintain we have the best system in the world, it's certainly far, far from perfect. And one of the reasons it's far, far from perfect is because there's so much bureaucracy and federal dollars put into the system. So when you come out as the Biden administration and say, you know what, if you take federal dollars, right, if you take Medicaid or Medicare money and you're a healthcare provider and you don't have all your employees vaccinated, you're going to lose those federal dollars. You will immediately and very negatively impact the business model, if you will, the ability for these hospitals to even stay open. if they don't get these federal dollars.
Right.
And that's the last thing you want right now.
Right. But it's also doctors' offices that take patients who are
Yeah,
Medicare or
and-
Medicaid patients, and they could lose their doctors because if a doctor says, "I'm not going to do this," well, then that patient has to go someplace else.
Yeah. So what I just said, is the decision to get vaccines between you and your doctor. Well, if this keeps going like this, you won't have anybody but Joe Biden to go to for advice, right? If you should get a shot or anything else.
Yeah, and well, I hope I don't get sick. Look, you made references about the numbers, and you were recently criticized by your governor, actually, saying that you don't believe the numbers anymore. And frankly, let me just say, disclaimer, I'm with you. But how do you defend that against those that say, how do you claim you don't believe the numbers?
Well, it's quite simple. I mean, look how many times they've been revised all over the place after they've been put out. And it's not even about my state Department of Health. I'm assuming that they simply get numbers from healthcare providers. I'm assuming they can add them up correctly, and I'm assuming they can pass them on to the CDC. But it's that old data provision where they say garbage in, garbage out. And if you don't know, if there's no standardized criteria for how these numbers are created in the first place by healthcare providers, you can't hope to aggregate these numbers and report them on a national basis correctly and accurately. It's just, and there is not. There's not a nationalized or standardized way, standardized criteria for determining whether someone died of COVID or whether someone died with COVID.
Right.
But was really killed or injured or whatever by something else, some intervening cause. Right. And so this is common sense. You don't need me as an attorney general to tell you this. This is just common sense. And
we need somebody to tell those folks that are counting to use common sense, because somebody's not. General Rokita, always great to talk with you. Best to you on Friday as you defend those healthcare workers.
Thank you, sir, very much.